Hello everybody, my name is Dr. Haiavy, and today we're going to be talking about saline versus silicone implants. So patients usually want to know what is the biggest difference between saline and silicone implants. And really the biggest difference is the feel of the implant. Saline can look good as well as silicone can look good on patients, but when you touch and feel, you can see that the silicone is a lot softer because it's filled with a gel, and the gel is closer to a natural breast consistency. The saline is filled with salt water, and it is still fairly soft, but you can see that it's a little bit less giving and a little bit stiffer than the silicone implant. So I would say if there was one difference that would be the most important, is really the feel of the implants. In terms of looks, they can both look great and they can both achieve a very good result for our patients. I have thousands of people that have saline implants and are happy with them, and same with silicone. So is there a difference in longevity of these implants? That's a great question. There has been no comparison study in terms of longevity between silicone and saline implants. I can tell you that the risks of leakage or deflation of the implants, as well as capsular contracture, which is the hardening of the scar tissue around the implants, is pretty similar between the two products. So they're very similar in those regards. We don't know the longevity comparison between the two, but I can tell you from my personal experience, I have patients that have been with breast implants now 18 years, 19 years, 17 years, and they had a tuba saline implant and they still look great. My recommendation to every patient is that you should check your implants every 5 to 10 years with your surgeon. Make sure that they're intact. If you have silicone implants, you will need an MRI every 5 years to check and make sure that the implant shell is intact and there's no tears in the implant. If you do find that there is a tear and there's a leak, the companies have an excellent warranty. They warranty your implant for a lifetime, and they will give you another implant complimentary at no cost to you. And for the first 10 years, they even cover majority of the cost of surgery. So, they both need upkeep. With saline, if the implants leak, obviously you can tell because it's one down, one up, right? It's obvious. With silicone, it's a little bit harder to tell. But I think they're comparable in longevity and risks. So the question is asked if the patients ultimately decide which implant they have. So majority of the time, yes, but it really depends on the patient's anatomy. So when you come in, we will examine you and we'll take some measurements. If you're on the thin side, in your tissues up here on your chest, we will be recommending a silicone implant to you. If you have enough thickness here and you're looking for a different type of look or more firmness, then we would probably go ahead and recommend saline. Majority of the time, the patients do make the choice on their own, but we will guide you in that process. How can people reach out to us? Is fairly simple nowadays. You can send us an inquiry through our website, which is inlandcosmetic.com, or you can call the office at 909-987-0899, or message us on Instagram at Inland Cosmetic Surgery or at Dr. Jacob Haiavy. Thank you so much for watching this video about saline versus silicone, and look forward to talking to you again in another video soon.